it.
Hi, kids.
Hi.
As doctors, we like to know the best way to help our patients, so we're continually reading the latest treatments recommended in our medical journals. But there is one recommendation that's going around that I think needs a different perspective. It has to do with something called bronchiolitis.
Bronchiosaurus? No, that's a dinosaur. With asthma.
Bronchiolitis is what we call a bad cough in a kid under age 2 years. It is basically caused by a virus. It's the kid form of adult bronchitis. It seems like a lot of research time and money are going into answering the question of how to treat this. And the recommendations basically say, you don't. Now, in cases like asthma, we treat with albuterol breathing treatments and steroids. But the research says that bronchiolitis is not supposed to get these medications. Now, if those medications were harmful, or they caused addiction or resistance, it would be one thing, but they're not. Not if they're used for a few days to help some symptoms. But for some reason, researchers have targeted these inexpensive, simple medications and given them a big thumbs down. So, many emergency rooms and clinics are marching in lockstep with those recommendations and simply turning kids away at the door. So what's the consequence of following this recommendation? Well, families feel like doctors don't care. The worry level remains at level orange, and the families begin doctor shopping and end up in multiple emergency rooms and urgent cares. And there aren't any studies that talk about that. They end up switching doctors out of frustration, and the kid is caught in the middle, often getting exposure to sicker children and further burdening the healthcare system. Also, I've found that some forms of bronchiolitis actually respond to albuterol and steroids. Now, this may be asthma in disguise, but since that diagnosis is rarely made before age 2, perhaps a trial of albuterol to determine if it is an albuterol-responsive bronchiolitis would be appropriate before turning away patients. And please, stop trying to use inhalers instead of nebulizers in infants, another silly study that we can talk about next time. I'm Dr. Watson. Thanks for listening.
I liked him better on PC too.
In a world where disclaimers are boring, one man...
Excuse me, Mr. Movie Trailer Voice Guy, please just read the copy in front of you.
Oh, sorry. This video is intended to give you informative, educational information. It is not intended for you to self-treat or diagnose yourself or your family. Because we want you to make good medical decisions when it comes to you and your family's health. Please first talk to your doctor before trying or attempting any of the information that you have seen or heard in this video. Thank you.
If you enjoyed what you saw today, don't forget to like us on Facebook, follow us on Twitter, and subscribe to our YouTube channel.